Everyone, welcome to our first Segurite Land Trust speaker series. The speaker series is called Seeding Hope, and this is you're joining us for our first program, which is tonight. I really want to give a big shout out to Inez. Inez wants to stay incognito, but I really want to give a big shout out to Inez for organizing this event. Inez, also you were the brainchild behind this. So I just want to say thank you so much, Inez. Big shout out. For those who might not know, and perhaps outside of the Bay Area, Segurite Land Trust, and it is an Indigenous women-led land trust that's located here in Huichin, Oakland, California, and it is the only Indigenous women's land trust here in the Bay Area. The work of Segurite Land Trust is to repatriate the land back to Indigenous ownership. So before we go on, I want to introduce one of our young warriors, our young sister leaders from the Bay Area, California. She's going to come on and introduce our wonderful culture bearers that are going to be offering the opening song. And also, before we go on, it's really with great humility. It always brings so much tears to my eyes. That we are on Indigenous land. The first people, the first caretakers, the stewards of this land of the Ohlone. Specifically in this part of Oakland that I live in is the Lishan Ohlone. And so it's really with great humility that I acknowledge that I'm on unceded, stolen Indigenous land. And although I'm a daughter of Moana Nui, or the Pacific, the part of the world that's now known as Polynesia. Although I recognize that I'm also an Indigenous daughter, it is when I come into this land that I recognize also that I am a guest. So with great humility to the Ohlone, the Lishan Ohlone, we thank you for your Tauhiva. For us as Tongans, it's perhaps the most important methodology of being Tongan. It's a system of connections and interrelationalities that are always centered within the land. So Najoni Brown, young sister, do you want to come up and introduce our next two singers?
I would love to. Hello, everyone. Good evening. So today we're going to open up today's talk with a offering song by Rupa Mayra. Aurora is from the Great Blackfeet Nation in Montana, and she is a cultural preservationist as well as an educator and is recognized as a wisdom carrier within the community. Joining her will be her son, Kevin. He's also representing the Great Blackfeet Nation and also Samoa on his fraternal side. He's one of our team members at the Land Trust, and he's a great teacher, sharing lots of information about beading, regalia, medicinal plant use, seed saving, dancing, and offering songs as well in our meetings. Both of these leaders are very respected within our community, and if you go on the website or on the Facebook page, you can read their full bio in its entirety, really to just show you how much they're doing within our community, all the great things.
Thank you. So it's good afternoon, everyone. It's good to be here today. Pretty sure Kevin's on his way, so I'm gonna I'll start it off with him here with me in spirit. I know he loves to sing together. He's recently just really picked up some songs and been really singing them strong, and I'm proud of him for that. So yeah, just putting prayers out there. Want to honor my California Native relatives, my ancestors whose land we're on today. Honor my ancestors that came before me, that whose footsteps that we walk in. I often say that we're led by the Spirit, you know, and we walk in their footsteps. We walk in prayer, you know, we walk in their footsteps, and so today, I just want to open up with a Strong Woman song. And this Strong Woman song came to my Aunt Gail Bearchild up in Montana. She was walking through the mountains, and this Strong Woman song is for women in recovery, you know, and I just want to honor each and every one of you out there. Segurite Land Trust, you know, Sister Karina and Janella and Fui and Loa, all of you that are out there the whole team, you know, really giving thanks and gratitude for what you're doing out there. And thank you for this wonderful workshop today, and looking forward to hearing the speakers. And so I'm going to sing the Strong Woman song today. Oh, thank you.
Oh,
Wow. Mahalo Makaloa. Mahalo Makaloa. Sister Aurora. And also to our nephew too, who's here with us in spirit. And I really want to give a shout out to you, Sister Aurora, and the important work that you do to heal our communities here in the Bay Area. Really want to say thank you so much for each year you reach out to us and you invite many of us from the Pacific, your sisters from Wananui, to come and be part of the ocean walk, the ocean walk that you do each year, and also the wonderful sisters from the Native American Health Center. So I want to say thank you so much for always including us, and also for Tauhiva for reaching out and honoring those sacred relationalities that we have from those of your relatives, our relatives here from Turtle Island, to those of us from Wananui. And so also again, a big shout out to our Samoan community, because we have some important Samoan community leaders who are watching this show today. And so we really want to say talofa lava relatives, and alofa tele atu. You know, brothers and sisters, for me as a Pacific Islander, I'm always humbled. I recognize that my people are really invisibilized in the United States, and we're also inconsequential on the colonial map. So when we come together like this, you know, in the Pacific, we usually have a whaikawa, or would be around a kava bowl to do these kinds of conversations and to talk story. So I really want to say thank you so much, relatives, for overseeing us. Last week, I was in conversation with Native Hawaiian leader, Maulani Teal, and was from Mauna Kea, one of the protectors of the sacred Mauna Kea in Hawaii. And one of the important lessons that she mentioned that I remember, and I just bring it up, she said, although the US government, the US empire refused to see us, one of the acts of decolonization, and perhaps the most important, is for us as Indigenous people, is to see and to recognize each other. So my Indigenous relatives, especially for many of us from Moananui, from our brothers and sisters from West Papua and who are part of the Free West Papua movement, we see you. Samoans, Native Hawaiians, we see you. So thank you so much. Thank you to your Ainga, thank you to your Kainga for joining us. Even if it's not around a kava circle, we want to say thank you so much. Kia ora also to our relatives from Aotearoa, Bulavinaka to Fiji as well, because I know that we have Fijian community leaders who are also joining us today. So brothers and sisters, before we go on, again, acknowledging the sacred land that we're on, we're also really blessed to have Ohlone, Lishan Ohlone tribal leader, traditional tribal spokesperson, Karina Gold, who's also here. She's going to be offering us a prayer, and then we can go on.
Good day, relatives. It's so good to be here. Thank you so much, Pui and Inez, for bringing this together. Thank you for our speakers for being here today. I'm just really humble to see all of the amazing people, you know, all of the folks that I know that's on this Zoom right now, and folks that I don't know personally, but I look forward to getting to know better. I just wanted to offer a short prayer so we can begin the amazing conversation with the folks that have taken their time to be here today. So I also want to say thank you, Aurora, for that beautiful song, and to let you know that Kevin is probably on the land right now. As I was leaving with Janelle, or I was leaving before Janella, they were starting to put in posts, like with cement and stuff. So I'm sure that he's out there working the land, and you know, he's an amazing worker. And thank you so much for being a good mom to Kevin. So with that, I'd just like to offer a prayer. I'd like for us to bring in all of our ancestors from all four directions and ask them to be here at this time with us. We're at a very difficult time in the world right now, and I'm just want to offer some prayers, and so that we can just be centered, so that we could all open our hearts and our minds to one another. So with that, grandmothers and grandfathers, creator and ancestors, we thank you for our lives, and we thank you for this day. We ask that you take care of all of those that are sick and all of those that are on the front line. We ask that you take care of those that are in mourning right now, and that you lift up their hearts and make them a little lighter right now. We ask for special blessings for our relatives that are living without a roof over their head, and for those frontline workers that are helping them as well. We ask grandmothers and grandfathers for prayers for our waters and for those that are living in them. We ask for special blessings for the next 7 generations and beyond, that they have fresh water and clean air and good soil, so that they could live in a good way. We ask grandmothers and grandfathers right now for the courage, for the openness to hear the messages that we are supposed to hear, that we come back in right relation in this earth. We ask grandmothers and grandfathers to give us the things that we need in order to go forward. And we thank you so much for bringing us together in this virtual way, so that we can share community with each other. We thank you so much for the abundance that you give us. And we ask that we, in turn, share that abundance with others. We thank you for the lives of our children and our grandchildren and those yet to be born. And we ask that our ancestors continue to take care of us and continue to give us the messages that we need in order to go forward.
And thank you so much. Thank you so much, Karina. And also thank you again. Karina, thank you so much for Tauhia Tawa. For us as Tongans, that is perhaps the most important work. The honoring of our sacred relationalities from your land here, Huchen, to those of us from the Pacific or Moananui, and especially Moananui. Your work to support the Free West Papua movement, your work to also support our brothers and sisters, the warriors on Mauna Kea, also your work to support our sisters and brothers in Aotearoa, New Zealand, and Nihu Mātau. I want to say thank you. Thank you so much for Tauhia Tawa. So brothers and sisters, before we begin, I guess we'll just take a deep breath. I mean, I'm sorry, maybe that's just a little selfish for myself. We heard some beautiful songs, offerings to the Creator and to our ancestors, from our sister Aurora. Thank you so much, Corina Gold. And just want to introduce, I just need to take a breath also to introduce our two warrior sisters who are coming up. You know, brothers and sisters, we were just so grateful, Inez and I, we were so grateful that our two sisters said yes. Because these are two experts in the field, in so many fields, right? And not just as physicians, but also out in our communities, both in a local and global level, that we have these, I guess to use some words, renowned sister warriors who said yes when we asked them to please join us in this conversation. So let me just begin, again, as our young sister Najoni said, you can find their full and extended bios on our event page, but just for the sake of time, I'm just gonna give kind of a little abbreviated bios to introduce both of them. So first, our sister Kalamaoka'aina Niheu, Kanaka Maoli, Native Hawaiian, physician, born on the front line of the Hawaiian sovereignty movement. Dr. Fo'oni Pa'a na Hui Kalo. She has supported the revitalization of traditional kalo farming and food sovereignty for 20 years. Co-founder of the Standing Rock Medic Healers Council, as well as the Mauna Medic Healers Hui. She is currently an associate medical director in the Bay Area, California, and a member of the COVID-19 response team. And our sister, Rupa Mayra. Rupa, am I saying that right? Mayra, okay. Our warrior sister, Rupa Mayra, is an associate professor of medicine at UCSF and co-founder of the Do No Harm Coalition, an organization of over 450 health workers committed to structural change to address health problems. Excuse me, I'm already crying before we even started here. Rupa was invited by the Lakota health leaders and elders to help set up a permanent community clinic for the practice of decolonized medicine at Standing Rock. Dr. Mayra addresses health issues at the nexus of racism and state violence through her medical work and outreach with her band Rupa and the April Fishes. By the way, who is wonderful, by the way. I got an opportunity to check them out. Amazing. Also, Dr. Rupa was appointed by Governor Newsom to the Healthy California for All Commission. Again, everybody, to all our viewers tuning in, these are really shortened versions of the bios of these sister warriors who I humbly say are more than just role models, right? More than role models for me, and I know also for many of you who are tuning in today because you wanted to hear from them. So just to, the first question that I wanted to ask are the two doctors, experts on COVID-19. Rupa, you're a health commissioner on the governor's team for COVID-19, for health, excuse me. Dr. Kalama, you're an associate medical director and member of the COVID-19 response team. I wanted to ask you, firstly, just because most of our listeners are from the Bay Area, I wanted to ask you guys if you could please give us an update on your respective work on COVID-19, firstly within the Bay Area, California, and then secondly with your work with Indigenous peoples. Rupa,
Yep.
would that be okay if we could begin with you, please?
Yes, thank you so much for inviting me to be here. I'm very honored to be here to speak with you and to be invited into this circle of amazing people who are doing really powerful work, really powerful, deep healing work. I've been inspired by the work of Sogorea Te for several years and the work of Corina, watching what she does to awaken us all to where we are here, whose land we're on, and how we can be in better relationships. So Thank you. What I'm seeing, so I work as a hospital medicine doctor at UC San Francisco, where we have had several patients hospitalized with COVID-19. I am also, I have been appointed by the governor to this Healthy California for All Commission, which is a commission to look at how we can make universal healthcare a possibility in California, how to make that real. And I guess what I'm seeing right now is that we still have this, you know, we've done such a great job, I think, in the Bay Area of flattening the curve. We're not seeing the kinds of infection rates that we're seeing around in different other hotspots in the country, such as New York or New Jersey or Navajo Nation. We are seeing the disparities that are built into the architecture of colonized societies manifest themselves again, and they will manifest themselves with every scourge, be it police violence or environmental racism. But we're really seeing it now again with COVID-19, in that Black, Brown, and Indigenous people are being more impacted by the infection, both in terms of infection rate as well as in terms of deaths. And we are, you know, we are seeing the impact of air pollution locally here in East Oakland, where I live in East Huichin. There is this combining of forces to make this infection particularly terrible. And that is the long-standing impact of air pollution is sort of primes our lungs to be chronically inflamed. And when you add to a low level of smoldering inflammation in our lungs from air pollution, an infection like this, it drives a massive inflammatory response. And so I see COVID as this infection as the first in a series of climate shocks. It's the first global experience that we're witnessing of a climate shock. And air pollution, the impacts of air pollution are made much worse with a warming planet. East Oakland also has very few trees to help cool, to have a cooling effect. So this experience has been, you know, just another awakening of things that we've already known, that we need to attack all these things simultaneously if we want real health outcomes to be different. And so while we are flattening the curve, meaning that we, by our social solidarity through physical distancing, that we've done quite well here in the Bay Area, the infection is still there, and we have to still maintain those levels of protection amongst ourselves to make sure that we don't get, you know, repeated peaks. So those are some things, some surprises that have happened in the last week that we've learned about, is that the first case of COVID in California, actually in the nation, was now seen as someone who died on February 6th in Santa Clara County, also Ohlone Territory. She was a woman who was 57 years old, who had no prior history of heart disease, who ended up dying from cardiac complications. Actually, it seems like from the autopsy report that her heart ruptured. So this virus is causing inflammation in the lungs and in the cardiovascular system. And so it's not, there's a lot of still things that are unknown, but we do know now that social distancing works. And that's, you know, not a way to say, oh, look, it's not as bad as the flu because, you know, not as many people died. It shows that because of our protocols that we've been following, we've been doing well, at least here. In other places, it's been much harder. We're also seeing the disparities of people who can't stay home. So mostly Black and Brown communities who don't have the economic capacity to stay home, or who are working in front-facing jobs that are deemed essential. Those people are also most impacted by this. So it's really falling along structural, socioeconomic, racial lines. The Black and Brown communities are the underclass that serve in colonial societies, and this is one of those colonial societies. And so if we want to see a change to those outcomes, we have to start retooling those systems of power. And that's what I'm hoping this outbreak this pandemic will help us see more clearly. I personally am enjoying the clean air in Oakland right now. I'm enjoying less people on the streets. I'm spending a lot of time in our garden, where we are waking up seeds and trying to think creatively how to work with our neighbors to create more food for our unhoused friends. So it's been a really powerful time.
Thank you so much, Dr. Rupa. And what you're also referring to is very important, not only because at this moment and at this time, protecting the sacred is central to healing. And these are questions also that I'll ask you as we proceed. Dr. Rupa, we also want to give a shout out to your husband, Benjamin, who's a big part of the work that you do. And he's an amazing farmer here from our wonderful town, Oakland. And both of you work together in collaborations to create healthy farming methods, as well as also food sovereignty for the communities. So, and we know that the beautiful family is watching. So we want to say, what's up, everybody? So thank you so much, Dr. Rupa. And we'll go to you, Dr. Kalamaoka'aina.
Lahaina, Kalamaoka'aina kia, palikuna ko'olau ka papamoku hina. And that's just honoring of the mountain that I've come from, as well as which represents the male aspect, and Kapapa, which is the island that is near the bay that I'm from, that represents the female aspect. I want to also just at the beginning honor the fact that we are on U.S. occupied, I call it U.S. occupied Ohlone territories, because it is truly an occupied land in a way that is so profound and deep that it's been very humbling to be a guest here. And I thank the Ohlone peoples here for allowing us to be here in such a generous and beautiful way. So for me, I don't want to add on to, I don't want to repeat a lot of things that Rupa had mentioned because she got it really point on about the racial disparities. But I also want to build on it a little bit more for my, expand upon some of the experiences that I've had. I work primarily as an outpatient family medicine physician. And what we're trying to do is coordinate in the community with different healthcare systems, you know, Kaiser, Sutter, Department of Public Health, in order to really address how we're going to turn into nuts and bolts this whole idea of what a pandemic means and how does it manifest and how does that manifest in the bodies of women and families, indigenous peoples, people of color. And I think that one of the things that we really recognize the deep and resounding terror, particularly from indigenous peoples, but also from African American peoples as well, of how fearful we are of losing our elders. And this is an illness that primarily affects and strikes our elders. And there in our families, in our families that we honor, is that we don't, we tend to live together in multi-generational households. The idea of a 6-foot distance between people is really an elite privilege, and also one that's been incredibly lonely and divisive and separating. And the decisions to make people be separated out don't take into account the community in which we live in, which we tend to live in smaller households that have small houses with larger numbers in our household. So it's really difficult to really contain people within our own homes. We don't have multiple toilets. We can't have dedicated toilets. We can't have multiple kitchens. Separating from a group of people is not only not something that we would desire to have happen, but is also economically unfeasible to do. And we're also amongst the community primarily that really cherishes the fact that we are able to take care of each other. But here we have we have situations, and you hear the stories happening in multi-generational households, both in brown and black communities, is that one person will bring in that infection not knowingly, completely without any type of malice or an ill intent. Often they're people who are essential workers who have no choice but to go to work and haven't been protected and up until really recently by public health measures. And they can go out and they come home and they can bring that illness home. Because everybody is in such a close-knit environment, it's almost impossible for that to not ravage throughout the entire household. And with the limits of protective equipment, community protective equipment, all of those devices have been taken up. Even the face cloth mask, even the simple types of protective gear, where they can't even practice it at home. And we're not inherently more likely to be ill. We're not inherently more likely to get coronavirus. What we are is that we've experienced generations of dispossession and isolation and vilification in a way that we are not connected to the healthcare systems. And here we are also within a healthcare system that's incredibly fractured and broken. And so today we had this meeting between all the different organizations, Sutter, Kaiser, Department of Health, our organization, multiple other organizations. And we're talking about implementing broad testing and possibly in the future, antibody testing if we actually get something that's reliable. But the thing is, the models that we're looking at, North Korea, Italy, Spain, UK, Sweden, Norway, all the ones that have, even in China, all the ones that have been able to implement these really international, these really sweeping broad policies, they've all come under a national health system. Here you have Boris Johnson, the Prime Minister. He goes to the same national health systems. When he got COVID-19, he goes to the same national health systems that the poorest person, the immigrant, that will be in England. It's the same healthcare system, the same healthcare workers. Now we are here trying to figure out who's going to do the testing. How does it go? And in the nuts and bolts of, oh, it's workers' comp. Oh no, it's your PCP. Oh no, you are, you're uninsured. You're in IHS. You're in Indian Health Services. We're all fractionated in a way that where everybody's kind of frozen in this way that makes it impossible, almost impossible for us to work together. And meanwhile, the health insurance companies are making a killing. They are literally making tons of money off of the 99% of folks who are not getting ill, who are staying home and still paying premiums, yet having no accountability to the greater population as a whole, and restricting us from being able to test more broadly. And here we have the Department of Public Health, which is incredibly underfunded, being expected to take on these responsibilities that have not been taken on by the federal government. The federal government that talks about a leader that talks about injecting disinfectant into our bodies in order to fight this infection. That here we have the deep and incredible denial of climate science that now has manifested into a deep, incredible denial of what happens in the science of pandemics. So the dismissal of the pandemic unit of CDC, all of those things, the dismissal of actual real and proper healthcare and funding for Indigenous communities and tribal leaders and tribal health systems, as well as in their inner cities and our rural areas where our brown and Indigenous and Black folks are, that all that historical defunding is now you're seeing those cracks starting to split wide open. And right now what we're looking at, do we have a really good plan as far as how we're going to do testing? We don't. We've been dealing with this now for a couple of months and we don't have a concerted plan. And here we are, we're all saying the same thing. We need to be able to identify the infection. We need to do good contact tracing. We have to be able to then isolate and do it in a humane way. And we don't have any plan because right now all of these systems are totally fractionated. And so when you look at the requirement for humanity and science to come together, for also ethics to override insurance and monetary systems, to understand that right now 50% of all healthcare dollars go to figure out just who pays. So here we are. We have to change. We have to break the rules. And that's what I'm trying to do in this way, in a very nuts and bolts way, try to figure out how to break those rules, but also to create systems that are able to reach out to people in a really good and healthy way. Because within science, there are some immutable rules. There are also some things that we have thought are immutable. The idea that the health insurance system, the way it's set up right now, is the only way that we can be. The rest of the world has been doing this, like lots of places that have the resources in California, which is among the richest nation, best richest states in the United States, in the richest world, one of the richest worlds in the planet, being unable to take care of their most vulnerable. So I think that right now we have to figure out a way in which we can address that and break through some of these barriers. And I think that this is actually an incredibly ripe time to be able to put those things forward, to point out the incredible flawed and vicious and murderous and inhumane separation that health systems have, that makes one person sitting next to another define how you get cared for, by when and by whom, what treatments you receive, and what protections that you might get.
Can I respond to that brilliance there? Kalama, it's so good to hear you speak again. I miss you so much.
I know.
What you said hit so many things. This is the time to agitate, for everyone to agitate for single payer in California. If we can't get it nationally right now, we must agitate for it here and now in California. Millions of people are losing their jobs and their health insurance right now. So those cracks that you speak of are going to get wider and wider. And the fact that we can't coordinate this, when you look at a country like Taiwan, which is of course smaller, but still has universal health care, single payer health care, and they had a centralized way of tracking this pandemic from the start. And they did an excellent job, and have much lower rates of infection. And they procured PPE like you would never believe. They had so much PPE that they were just giving it away to other countries because they were prepared in January. So this is something that we need to agitate.
Rupa, I'm just going to ask you, just for our viewers, many who don't know the term, who don't know the term PPE, can you explain what that means?
PPE is personal protective equipment. It's what we need. It's the masks and face shields and hair coverings and shoe coverings and gowns and gloves that we need to be able to do a safe job as healthcare workers and not get exposed ourselves. What was alarming to me also, to reflect on what you were just saying, Kalama, was in the hospital at UCSF, in the hospitals, and what we're seeing this all over the country, we are being told so many different things about what kind of masks we need and don't need. And in as late as March, I was watching as, our security staff, which are predominantly Pacific Islander, black and brown, they were being told not to wear masks. And they were, in the way of so many people every day greeting people at the hospital entrance. Our frontline workers who are at the desks of the at the different radiology, phlebotomy lab, they were being told not to wear masks. And so some of these people have become ill with COVID-19, and they are now being told by the healthcare systems that they didn't get it at work, that in order to be defined as a workplace encounter, they have to have been in front of a known positive COVID patient for 15 minutes. However, 50% of these infections are asymptomatic. We don't know that they're carrying it. So what I'm seeing happen in health systems is that those jobs that are held most often by black and brown workers are people who are now being denied workman's comp for their infections. So they're getting sick. They were withheld, PPE was withheld from them. They were told it was unnecessary for them to mask up. They've gotten sick. And now because of the narrow definition that hospitals are using around the country, a lot of these workers are now unable to go, speak to OSHA. So this is a major labor issue, and we need to start seeing solidarity amongst doctors, nurses, phlebotomists, janitors, house cleaners, cafeteria workers. All of the workers in the health system need to demand accountability so that COVID is listed as an occupational hazard, because it is, because we're seeing nurses and doctors and phlebotomists and people dying in our country. And so this to me speaks to the same thing that you were just speaking of, Kalama, which is this real need for a deep culture of care to overthrow this culture of lack of care. That, if so much money is being spent in our healthcare system deciding who's paying for what, that system needs to be overhauled, and a new one needs to be put in its place to manage these, because this is just the beginning. Imagine coronavirus with the fires that are coming. Imagine that, California, because we're going to be up such a creek. You won't have time to reach for your insurance card as you're running out the door.
Right.
We need to be nimble and prepared. And what that means is we need to centralize humane care above and beyond the dollars. So that's the work from the governor's level, from the government level. That's the work of agitating and advocating with different groups that I've been doing now to try to push the agenda of single payer now, and also to try to push the agenda of eliminating sources of air pollution now, because these things are just going to compound on each other. So the pesticides that are being just sprayed in our Central Valley, we need to move California to regenerative agriculture now, our whole system. We need to move to a system of earth, water, air care now, because COVID is just one, and it is worse in every place where people's health is compromised by these long-term exposures. And those people who are most compromised are people for whom suffering is built into the architecture of colonial structures, which are people who look like me and you. And so that is really, it is really a time to galvanize our environmental movements, our indigenous movements, our health movements, our demand for single payer now. This is a time where we need everyone to step up their game and get active.
Wow. Dr. Kalamaoka'aina, you had something to say as well?
Oh, I just said AO, which means in our language, exactly. That is a deep and very powerful truth.
There's so many powerful truths that you both said. I'm looking at the chat right now. It's lighting up with folks from all over the world actually agreeing, deeply agreeing, deep-heartedly agreeing with everything that you both said, with all the information that you both said, the many layers of the inequalities. What we're seeing is the structural violence that is uncovering at this time of pandemic. Is that, again, from what I hear from both of you, is that so many of us people of color have known this for generations, and now it's uncovering. And as I also hear from both of you, complete hope as well, that this also, that there can be changes made, that we need to agitate as a people, and as families, we need to come together and agitate, bring our va together, work together in coalitions, and to work together again. You know, this also leads me to my next questions about the importance of the environment, and what I heard both of you talking about, the importance of the land, the importance of protecting the sacred, that both of you in your important work have shown. This is one of the connections that you both have, is that you both worked as medics for the Standing Rock movement. An important movement in 2016 throughout the world. Not only was it here in Turtle Island, but it was all over the world. It incited so many movements for decolonization for indigenous peoples. We were so excited to be part of that movement here in the Bay Area, as well as so many of our relatives from all over Mauna Nui. Maybe we'll begin off with you, Dr. Kalamaoka'aina. I wanted to ask you, in your work to protect the sacred, how does that impact, or how does that help shape the goals? I mean, obviously it does in what you just talked about. How does it help, how does it shape your healing practices in Western medicine, and also your work as a healer overall?
Well, fundamentally, that the great and deep and horrific wounds that have been inflicted upon primarily indigenous and African American peoples throughout the world, they started in our communities, but we are simply the canary in the coal mine. They are starting to being magnified, and then the chickens are coming home to roost. You can't create a dysfunctional, exploitative, destructive system. You can't put people into a meat packing industry where they don't get PPE and are forced to sit right next to each other. You have, and don't have proper protective equipment, and mass reduce these meats that are going from one place that completely destroys and decimates the environment around it. And then they get decimated because they're poor. They're like the working poor and the most vulnerable. And not only is it destroying the environment, but it's hurting the people. Now we have massive amounts of COVID-19 going throughout the meatpacking industry. So the same type of infections, the same type of ailments that you have from having this concentrated, rushed, inhumane, product-oriented instead of human-oriented creation of food and sustenance is now going to ripple effect. And they're already saying that the food systems and supply chain is starting to get broken. We got about, like, I believe about 20% of the chicken supply for the United States is being interrupted. I believe about 10% of the pork supply has been interrupted simply because of the horrible situations in the meatpacking industries. And I think that what we have to do is whenever we look at our healing work, we have to look at the bigger picture and look at, we need to have these communities, these locally sustainable communities that are controlled, that have the resources, your food, your health, your healing, your education, your arts, your spirituality, all of those things in a close area. We shouldn't be doing these really broad commutes. We shouldn't be having these disconnected communities. We shouldn't have these global situations where people who leave their communities are going to be in a better off situation than the ones who stay behind. And so here we have the healing that has to happen, has to be within the context of how you can do the best work you possibly can. But at the same time, if you try to take it all on, I think that's something that is, we want to, you want to attack the monster. We understand that that monster needs to be taken down. But if you don't figure out what it is that you can do, what your skills are best suited for, you're gonna break your spirit down. So you have to figure out what is the best utilization of your own particular skill that can be led to this greater goal. And you don't have to take on all of it, but don't forget that it's there. Don't forget that that larger piece is there. And whatever skill you have it be part of a larger communal goal and thrust. And know that where you're going to, because if you forget, if you look at the whole world and think you gotta fix it all, your heart's gonna break. But then if you just do your own little thing right in front of you and don't put it in the larger context and don't make it a part of a larger movement, you can become like the Germans who were participating in genocide. You become just a soldier who is trying to fight for your freedom from the Britain, and then participates in the absolute desecration and genocide of the First Nations peoples in their own home. You become one of those submarine operators who go and they bomb Morea or Fangataufa, or you have Bikini Island. So you have to, if you just figure out how to survive on your own, then you're going to lose the larger picture and you're going to participate by default in these exploitative systems. And we have to figure out how to disconnect. The reality is that we can't disconnect fully, but we have to try to be intentional about moving in the direction of disconnecting from that, from not participating in those oppressive systems. So one of the things that we're trying to do is we can't get PPE to everybody out there, but Rupa was very generous to connect me to Sarah Eagleheart, who's from the Heart Foundation, who right now is trying to get PPE out to the Indigenous communities. And I can go ahead and share that link with you guys later on about how to actually donate to that, because we're just starting right now to try and get these out. Because as you can see, definitely want to start to support the Indigenous peoples in the Bay Area, but also the African American communities. I think they're really starting to rise up. But my small part is that I can try to help raise monies for proper PPE to go to Indian health services and also Indigenous community, my Indigenous community back in Kalamaoka'aina Niheu, and try to get those so that the people who are supposed to be taking care of our most vulnerable, our elders, when they go to them when they're incredibly sick, that they aren't going to be the ones transmitting that illness to them because they have improper PPE or they're infected at the same time and they don't even know it and they're transmitting it to their patients. So I think that that's something that we can do. I have to stop myself all the time from beating myself up for not doing enough, from not, not having more time in the day, for not being more effective, and not being, because I'm trying to do the very best I can. And I think I'm doing a pretty damn good job. And I have to remind myself of that. But at the same time, we also have, as a larger group, I think that we have to, more people need to rise up and be a part of an integral part of change.
Yes.
Dr. Rupa, thank you so much, Dr. Kalamaoka'aina. I just before we go on to you, Dr. Rupa, I want to remind our young warrior sister, Najoni Brown, that you're coming on right after Dr. Rupa's answer. And also, you were talking about the the meat packing factories, Dr. Kalamaoka'aina. This brings up to me an article that I just read today that really broke my heart. Showing when we talk about inequality, the systems of racialization here in the US, and also the role of US settler colonialisms in the Pacific. We as Pacific Islanders here in the United States have one of the highest numbers of infection, actually 2 to 3 times according to the article here in the United States. And the meat packing, many of our brothers and sisters, the Marshallese, actually the Micronesians are usually our brothers and sisters, are the ones who are working these particular factories. So it breaks our heart in so many ways, as well as our indigenous brothers and sisters here on Turtle Island as well. So Dr. Rupa, you were also on at Standing Rock in 2016. You played an important role there also in the creating the healing for the people. What is the work of and the goals of protecting the sacred, working against the U.S. empire's desecration of the sacred? How does that shape, and how is that centered in your work of creating healing currently?
I think it's such a great question, Fui. Thank you. I think it's the most important thing that we can do. I honestly don't think we can go forward with healing until we go back and heal the wounds that have happened, that we're witnessing the historical playing out of these wounds in our bodies through chronic inflammation of our bodies. The colonizers, the colonized, all of us in this system are suffering, with the indigenous and the wildlife and the water suffering the most. And so I was blessed to be born in Ohlone territory. I have been blessed to have the heart of an artist and growing up in constant musical relationship to my surroundings. And I have been blessed to be just awakened to this other narrative that was here since I was really young, and very hungry to understand since I was young. And to find my family, colonized people from India, who've been so colonized over hundreds of years, that we fail to see the violence recreated here in this land, that we were part of as settlers here in stolen land. To watch my uncles laugh at me when I was 16, they were like, "Rupa, you're so smart. What do you want to do when you grow up?" And I said, I want to do something around Native Americans' rights and their health in this land. And he's like, "Why?" My uncle said, he's a diehard capitalist. "Why would you waste your time on something like that? That's such a done story." And I remember thinking that his words came back to me when I was at Standing Rock, sleeping on the ground there in between my medical shifts, listening to the singing going on all night, and just feeling like he had no idea that this would be actually the most important thing I could do with my life, is to understand these connections of the desecration of the sacred relationships to each other, that we have wounded something so sacred, which is how we relate to each other, which is how we see each other, what you were saying, Fui, about not even seeing ourselves. That violence we have turned into ourselves and into each other. The violence that we continue by not seeing the water and thanking it. The violence we continue by not screaming to get that air pollution to stop. That, you know, that when I moved to this area in East Oakland and noted that there was this polluter polluting the ABNI foundry, which I have a personal vendetta to shut that thing down, my first instinct was to want to run away. It was like, I don't want to be here. There's this poison in the air. I have 2 young children. What am I going to, how can I protect my children? And then I realized, like, no, I was brought here. My job is to shut that shit down. So that's my, you know, little corner of the world, where it's like, I see the violence that's happening here. I recognize it. I see it. I will talk to every single person I can and do whatever I can to inspire the people with me to shut this down. And this is when I see the chat lighting up, like, what can we do? What group can we support? There are groups you can support, but you're a group in and of yourself. Like, to find inside ourselves the ability to go on general strike. We see that what happens when we collectively decide not to go to work out of a desire to help our fellow human being not get this virus. So we've all agreed through this social distancing that was put in place, like, you know, people could have rioted when the governor said, no, shutting down non-essential businesses, and people could have said, forget that, we're going to continue business as usual. But people took a step back and they went inside and they stopped working. And we've been halting the business as usual. And what we've seen is the fossil fuel industry collapse. We've seen the stock market collapse. We've seen the government try to prop it up with trillions of dollars. We've had trillions of dollars to save our economy and still don't have enough tests, PPE, and ventilators. We still don't have those. We have doctors and nurses dying. We have nurses in trash bags, but we have trillions of dollars that have been propped up. And so we're seeing in that the vast power we have if we can act collectively. So the group that you can support is the group of humanity, is the collective consciousness that we have to shut this down, that we can make a pact with each other not to go back to work on May 1st until we get PPE, until we get testing, until we get single payer, until we get air pollution off the table, until we shut down the fossil fuel industry, until we get a Green New Deal, until we get rematriation of indigenous land, until we get indigenous women in the state of California to be the governors of how we manage our resources, our land, our water, our air. Because clearly the colonizers, the settlers, those of us who are here, who are not from this territory, who don't have those sacred relationships intact, we don't know how to live here properly. We need to admit that with humility and apologize and hand over the responsibility. So these are the kinds of things that I feel like we can start imagining into being through witnessing what has just happened over these last 6 weeks, is that the collective withholding of our labor causes the system to crash. So much so that they will pump trillions of dollars. So our non-cooperation with this system is vital. Our non-cooperation with this system is vital. And I say that so that we remember it as the struggle continues. When we're in another moment of chess where we need to assert ourselves, it is not necessarily through inaction, it is through inaction. It is through staying home. It is through taking care of ourselves and our families. So for me, the way I connect with the sacred is really working to give back native land, both through the relationships I can work with in my world, in different worlds I walk in, and then also in my own home, working with my neighbors. We've taken down our fences. We're healing the waterway that goes through this land. We're learning how to share in common. We are creating an easement for Segura Te on this land. We're talking with how we give back the land. And so trying to understand in tiny ways and in big ways how we can restructure and decolonize our own minds. Because truly, I believe through decolonizing, we can heal what has been broken by colonialism, which is our sacred relationships to each other, to the planet, to these entities that give us life. And so I see that as the primary thing I must do in my work as a healer. That is why I am here on this earth. That is what I do with my music. It's what I do in the hospital. It's what I do as I'm writing a book right now. And so I am inspired and humbled and in deep service of so many people I have met who are carrying this wisdom from all over the earth. And this is what it means for me to heal, is to uplift that.
Thank you so much. Thank you so much, Dr. Rupa. So with, as we take a breath, to take a breath, to let all this important information, this important wisdom and gifts of love, gifts of great love, as we let it settle into our hearts, we bring on our young sister warrior, Najoni. Najoni, you there?
Yes, I'm still here.
Najoni.
Hello, everyone. Good evening. Whoops. I think I minimized. Oh, I'm sorry. Okay. My name is Najoni Brown. I'm from present-day West Oakland, within the village of Huchin, by way of the Navajo Nation in Missouri and Mississippi. Born for the Bitterwater and Walk-Around clans on my Dene side. My background's in engineering, but I'm also an educator outside of my work with Sigorte. I'm just very passionate about providing exposure, just particularly STEM exposure, being able to shadow a scientist or an engineer for underrepresented groups, particularly for Black and Native young women like myself. And yeah, so that's a little bit about me. And then today I'm just going to talk a little bit about She'umi. She'umi is gift in the Chochenyo language, and through She'umi, you're able to give a voluntary tax, which is based off of if you're certain factors, like if you're a renter or if you're an owner. So it's a portion of your income in a way that you can help us to fund our operational costs here at the Sigorte Land Trust. And with those funds, we're able to complete a number of our programs that are there for our youth, there for the entire community. And some of our programs include language revitalization, so being able to speak about the plants and the produce and the medicines that we're growing in the Chochenyo language and refer to them with their ancestral names. Also speaking about Ohlone people in the present and making sure that we don't just talk about history, but what's going on now and what we dream for in the future. Another thing that we are doing is providing produce that is, if not free, affordable, and being able to create space and ceremony for youth in these areas. We do have a large intertribal community within the Bay Area, a lot of people that were displaced or relocated forcibly. So we have to think about those that are seeking out ancestral knowledge and those that would like to learn their cultural background. So we have the space for that, the medicinal plants, as well as our medicines like sage, tobacco, and mugwort and cedar. We're creating things like fire cider to help build up our immunity during these times, just taking care of each other and making sure that we have the things that we need. So a big part of that comes through She'umi, and I'll post a link in the chat so you're able to give as an individual or, someone already posted it, an individual or an institution, and it's completely voluntary and it's whatever you're able to give. And yeah, so if you have any questions, you could email us, visit our website.
Thank you so much, Najoni. Thank you so much for your great work with the Sigorte Land Trust, and just like our young nephew, Kevin Mamea. Thank you so much. As in our conversations, and also from the work that we all do as individuals outside of this chat, is the outside of this program, is the importance of the next 7 generations. And so you're so important to us, Najoni, and to Kevin, and also to the young brothers and sisters, the young nieces and nephews who are also watching this show, and those who are yet to come. You're so important to us, and this is why we do this work. We ask definitely our viewers, please stay on, because we actually have 2 beautiful songs that are going to come from both our doctors. But before we go to the last question, I wanted to ask you guys, doctors, about your role as guests on someone's land. You know, because I myself am a guest on this land, although I'm an indigenous daughter from Wananui, the Pacific. I'm still a guest on this indigenous land. And the reason why I ask you to please elaborate on that is because we have many of us are guests now all throughout Turtle Island. we're now occupying stolen land. What does that mean? What does it mean? What is our responsibility to this new ancestor, to this new land that we call home? You both have talked about it a lot in your work, and you also show us by example.
I think that part of it is you first have to come to terms with the very deep and humbling notion that you are a colonizer. When you can own that part of it and being a part of a destructive process, that's the first step. We ask it of our allies all the time, but we don't always do that when we step into other people's lands. So dealing with that reality of that, by being Indigenous, it doesn't release me from the responsibility. It doesn't release me from the harm. It doesn't release me from the fact that I'm here because for a period of time, I can't afford to be in my own homeland for a period of time. I am going to go back, but part of it is as soon as I can get to a place where financially I'm not going to be at risk for being evicted from my own home, from not being able to support my family right now, is like many Indigenous folks, when they leave their homes, they take care of family that are home. And so to get to that place where you can not be afraid that you don't have dozens of people becoming homeless from the work that you're doing, but at the same time, the only reason why you can do that is by the exploitative nature of benefiting as a settler in a colonial exploitative system. So I think owning that allows us to then work through some of the responsibilities that we do have, and being able to be kind to the people who come to our lands as guests as well, and to be good teachers to them when they do come to our lands. So one of the things that I try to do is I do try to pay tax toward the Sogorea Land Trust as being a guest here. And also part of the work that I'm trying to do is trying to pay it forward is understanding our Indigenous connections. So really investing myself very deeply into before I even came to the Indigenous movements throughout the world, and doing the sacrifice of the work and nonstop work for like almost a year with Standing Rock was one of the ways in which I could try to be a supporter of somebody who comes very often to this land, and continuing on the work with the PPE to uphold the leadership in the Native American communities of Turtle Island to speak for themselves and coordinate their own systems of healing, to uphold the work that's happening, by the Ohlone here to reclaim land, to uphold the work that's been doing all over, California, in spite of incredible odds. Is my voice is, my job should be to uplift the voices of the people here. And that's one of the things that would happen at Standing Rock in particular was, I made it very clear during, a lot of the discussions that the people should be speaking to the press, should be the people from the First Nations, primarily from, the Ocheti Shakowin, also the Standing Rock Sioux tribe. I could speak in front of folks, but my job was to do the research and to not put myself forward, to not make, Standing Rock a selfie, smorgasbord and marathon for my own personal narcissism and ego and self-aggrandizement, to really do my very best to put those voices first, to realize that even though my people are suffering, that it's secondary to the fact that the people that I'm here with fighting to support, they are the ones who are suffering the most. And so it is my responsibility to swallow my ego, to do what my mother says, to murder my ego every single day. Because it's a beast that will rise up and bite you in the butt time and time again. Because we have, in order to fight against these systems of oppression, we have to have a very strong sense of ego. We have to be able to feel that we have confidence in our voice and our leo. But sometimes when we are in those spaces, especially those of us who have places of privilege as being physicians, that we can sometimes have the ability to drown out the voices of the people who are around us. So to remember those steps, to walk softly, to step gently, the bigger your footprint is, to be that much more careful, to be the way you step. And for me, it's in many ways, I think that it has stopped me from, you know, reaching out in ways that to be a greater part of the community, because I've tried to be so careful about being a good guest here for this brief period of time. But it's really hard because our communities are so complex. There's no way that I'm going to be able in a couple of years to be able to understand all the complexities and who I should really ally with. But I'm trying to do the very best I can. And, you know, I have to believe in myself enough to have the faith in the people that I'm working with, and to see and watch and observe, spend a lot of time just observing the great work that you guys are doing over here in order to make sure that my voice is a part of lifting up all of us.
Thank you so much. Thank you so much, Dr. Kalamaoka'aina. And Dr. Rupa? Dr. Rupa, can we hear you? Can folks hear Dr. Rupa?
Oh, can you hear me?
Now we
Sorry. I was just saying I just love listening to Dr. Kalama speak. She just has so much wisdom and so much humility and so much perspective. And I remember sitting with her as we were waiting to leave Standing Rock one time in the airport, where I had the gift of being with her for like 2 hours, just listening and learning. And I feel like how to be a guest here, how to be a guest is, like Kalama was saying, is realizing that my presence here is part of the colonizers project, and that I'm a settler here, that this is not the land of my ancestors. And to really learn about what has happened and learn about what is happening now, and how my work can best support the efforts of groups like Segora Te and those Ohlone folks who are doing powerful work on reclaiming language and reclaiming food and reclaiming space. And I love the idea of singing in a choir, like that we're all singing the same song, and it's a song that's not our song, that we're actually amplifying the song that our Ohlone friends are singing, that they're finding their voices, that they're finding their way, and that we are entering new kinds of relationships that were not allowed by the colonizers, that were not part of the social prescriptions. And so I think that I feel like this question of how to be a guest here, how am I a guest here, is one that I'm still actively understanding and exploring. And it's an issue that for me causes pain when I go into it really deeply. When I sit here on this land that with my husband Ben, who's a farmer, that we're cleaning and caring for and planting and sitting with, just starting to listen and deeply listen to the land and the water as it runs over the land, and really feeling like what is the right thing for me to do? How am I supposed to be here in the right way? And these are questions that I'm turning over often in my mind. And on good days, I feel like what it inspires in me is the dream of great relationships, like just with individuals and with the past. And so my prayers now, when I pray to my ancestors and the ancestors of this land. And so that is something I didn't do before. And I do that now, and it just colors my world a little bit differently. And I invite my friends to feast together, to be together, to hear music together, to pray together, and to do ceremony together. And I ask for permission now when I do things in ways that I didn't do before. And they're all just steps in understanding the humility that I was not raised with in terms of being on this land, and the humility that was not taught to me in order to survive being a colonized person myself from my culture. And so it really is a part of my awakening and my ongoing awakening. And I think the reason why decolonizing is said with the ing ending instead of like a noun, it's not decolonization, I'm decolonizing. It's a process, it's a shedding, it's a dreaming, it's a imagining, it's rich with the same dreamy stuff of writing a song is imagining our new relationships to each other. And I'm so blessed to consider friends like you, Fui, and Karina, and Kalama, and all these beautiful people I've met in the last 20 years of my life, I'd say, who have been teaching me, and the animals. And my relationship with the animals have changed. Just the hummingbirds, the foxes, the owl that comes and sits in the redwood tree, and we dialogue for 20 minutes. It's just a beautiful, different way of being. And I think simply it was Anne-Marie Sayers who taught me to pray and say, to my ancestors and the ancestors of this land. And when I started saying this all out loud, it helped to open that door of pain that I feel, for my personal responsibility, and to open my heart to feeling. And that's what this is really about, is creating a culture of feeling. And when I think sometimes, I was talking to a friend who was telling me different songs, he's showing me different songs, and he said, yeah, no, we had a song for collecting acorns, and a song for waking up and welcoming the day, and a song for being with the water, and a song for this. And I just thought, oh my God, the Spanish came and killed a completely musical culture who had a song for everything in every part of the day. And how do we recreate those songs? How do we find those songs? Where are those songs? Who has the right to sing those songs? How do we share in that creation of space for the people to hear their songs and to sing them again? How do we sing in a chorus to uplift those people? And those songs. And so this is like, I feel grateful to you for asking these questions, Fui, and for your tender heart in how you express yourself on these issues. But yeah, learning how to be a good guest is my life work.
Malo sisters, malo and malofa. Thank you so much for the great love. So I'm listening to you and what you just mentioned, Dr. Rupa. You talked about dreams and songs. And so in our last couple minutes for the show, I wanted to ask you if you could please talk about a dream that you have for your children as mothers. And I really want to put up to our audience there that we're not privileging biological motherhood or the Western idea of motherhood. What we're talking about is birthing a new future, is birthing futures that are decolonial futures that resist the individualism that and capitalism that many of us have been brought up on, including the normalcy of violence against women. So, beloved sisters, I wanted to ask you, if you could put your dreams for your children or for the next 7 generations, if you could put this dream into a song, how would it sound like?
Kalama, I kind of want you to have the last word here. So.
You're the professional singer, but go ahead.
Well, I have my guitar here. And I thought I'd just share what that sounds like in one version of it. And I feel like what I want for my children, my beautiful sons, my beautiful, beautiful boys, is a world where these sacred relationships are healed and we know who we are, and that a culture of care emerges. So I just wrote this, and it's very short, but this is how it sounds. We are earth, we are fire, we are air, we are water, watch us rise. We are earth, we are fire, we are air, we are water, my dream for tonight. I love you.
Beautiful. So I'm going to try and do my best to follow that. And I wanted to offer up a song. I think that when I think about the dream that I would like to have for my children is that they would be able to give gratitude and thanks. That in the song we talk about laying out the mat and having an abundance of food and resources, to be surrounded by our families, by our ancestors, and to be able to thank them face to face for all that they have sacrificed for us. I would hope that what we are doing right now will be the groundwork that if there's to be strife, let it be in our time. Let it be us who struggle. Let it be us no more passing on the struggle for our children. Let us take it on head on so that when our children can grow up, that it'll be a time of peace and plenty. So the words that I'd like to share with you is a song that talks about gratitude, and it's a song of thanks. And we often share this when we are together to join with food and to share with nourishment. It's called Oli Mahalo. And hopefully I can sing it because now I'm feeling emotional about that. Uholaia kamakaloala, huai ke alohala, kukaia kahaloala, pavehi maina likua, mai ko o kuia kahalavaila, mahalo e na kua. Mahalo e na kupuna la ea. Mahalo me ke alohala. Mahalo me ke alohala. Mahalo.
Mahalo. Brothers and sisters, thank you so much for joining us today. We want to really, with great humility, we want to thank you for bringing yourselves and your families. We thank you so much for sharing your love. We can see our chat. We also want to thank our honored guests, Dr. Rupa Mayra and also Dr. Kalamaoka'aina Niheu. We also thank we thank our ancestors from this land, the ancestors of this land. Karina Gold and the Lashana Loney and the Ohlone, the first peoples, the first caretakers and the stewards of this land that we're on. We humbly thank you. We want to thank you for taking care of our relationships, our sacred relationships. We also thank, again, Inez, who created the beautiful artwork. Inez, can we put on the artwork one more time? Okay, well, we could just imagine it in our... No. The one, Inez, that you made for the Seeding Hope speaker series. So just to remind everybody that this is the first of a series of programs that we're going to bring to you, especially during the pandemic. We wanted to respond to many emails from our Bay Area and also from around the California, with folks asking for programs, perhaps with conversations to create hope and also to help us to reimagine the kind of work that warriors are doing and are also doing because of our great love for the next 7 generations. So again, Sister Aurora, thank you so much for the beautiful song, and also our nephew, Kevin Mamea, also our niece, Najoni, thank you so much. And to also our nephew, who's our nephew, wins. Did we have that photo up one more time, guys, with the beautiful artwork that Inez created? Okay, so Dr. Kalamaoka'aina, can you also give your information on how people can reach you as we, very brief, everybody?
The best way is right now is through Kalamaoka'aina on Facebook. Right now I'm working 15-hour days, 7 days a week to try and respond to this COVID crisis and to try and create systems that make sense for our most vulnerable. So my apologies right now if I'm not able to respond as quickly, but I'm going to try and also share. I'm really supporting the efforts from the heart, and the other, Andrew just shared a place that you can actually share and go to support First Nations peoples. So I think that's going to be the most important thing, is to support the First Nations here who are trying to desperately get the supplies that are needed. So if there's anything that people need to contact, that's going to be the places that you need to go to. And that's, rather than uplift myself, I think that I really want to uplift the work that Segura Te is doing, and also as well as the many, many warriors that are here that I've been a great privilege to walk amongst and to learn from. I'm humbled to be here. Thank you.
Thank you. Thank you so much, Doctor. And what a beautiful offering, actually, your answer was. So thank you so much. We're really humbled as well to hear that and to receive that offering. So in closing, Dr. Rupa, how can folks who also want to reach you and also want to help support the work that you do, is there any contact info that folks can reach you at, please?
I think the same is just through Facebook is a great place to follow or to reach out. It has been extremely busy at this time. I think that supporting the work of Return to the Heart Foundation, Sarah Eaglehart is coordinating getting PPE to all the different, several different tribes around Turtle Island. They are actually coordinating also with UCSF. We are helping to push out fundraising for that effort. There's also the HEAL initiative, which is a group at UCSF who trains different providers in communities around structural solutions to health problems. And they are in Navajo Nation right now. They've coordinated bringing UCSF doctors and nurses out there to help provide relief for the workers there. So they are doing amazing work. So follow them. And yeah, just keep supporting Segura Te so we can rematriate as much as we can in this area and continue to grow this beautiful community. Thank you so much for having me.
Thank you so much again, beloved warrior sisters. Thank you so much. And thank you again, relatives, for joining us. This is our first one. So we hope that you will join us. Again, we have 2 coming up in May. Yes, and we're pretty excited. Big shout out to Inez for creating the artwork and also for being the organizer for this event. And also, Rupa, you mentioned our sisters and brothers from HEAL who are actually online and who are listening to this show right now. We really want to say thank you so much for your great work. All right, everybody, now is the time that every Indigenous person hates. This is the part that we say goodbye. So we carry you all in our hearts. We carry you in our hearts and in our spirits. And we hope also that you carry us in your hearts and your spirits. And as you struggle each day to take care of your spirits and your souls, and to honor this land that you're on, we're right there, right next to you, as our good sisters talked about today. This work is collective, the struggle is collective. We honor our ancestors that came in the past, our ancestors that are here right now that are walking right next to you, as well as with the great love, and we honor our ancestors of the future. So thank you so much, everybody. We'll see you soon. Be good to each other.
We